Okay, here also. So you see, this is worse. And this is probably why her arm never heals. So how is the pain here?
Oh, y ahora me duele todo.
Now everything hurts. So we will just remove this pain here and re-examine her. So I will start to use very low devices, low frequency, because what we teach here is to understand each different layer of the tissue. Because if I use super strong, it will go too deep and will not actually take the superficial information. So I'm going to start to remove this here on the biceps and see how much that affects the lower arm, just to give you an idea how this is working and how actually the body's working.
You want to take 200?
Yeah. So I'm going to use a positive device. I'm going to explain later on the whiteboard how this exactly is working. I'm going to use one that's called P200, this one. This is a positive. This is the one that's activating. This is the outgoing neurological frequency. So I'm going to put that here. Just put your arm like this and relax. So I'm going to search for this here again. And the other one here. So now what this is doing is picked up immediately by the nerve system and the neurons and sending out an outgoing frequency. But as you all know that understand a little bit on neurological function, it needs a return and confirmation frequency. So therefore we use P minus 9. And this is the negative one. And then I've put that on the belly on the biceps, like this. I'm going to use some antioxidants. Antioxidant that remove free radicals is called ADL. It's actually glutathione, mainly produced in the liver. And this is the key for all kind of injuries and prevent any kind of inflammations or any kind of injuries to heal faster. I put this close to the tendons. I will use the carnosine, that is actually the body's called also natural anabolic steroid, because this is providing cell dividing, renewing cells, and rehealing the tissue. And I put this like this. So here we have 2 positive and 1 negative. So they will now contact and work here, remove the active inflammation, and the free radical removal, remove the reason for the injury. And this is immediately starting renewing cells. And this is the only way the body works, because everything is controlled by the nerve system. Because aging, any kind of pathologies come from neurological oscillation weakness. If that can be strong all the time, we can never get sick, we can never get old, and we can never get diseases. The key is to health is the nerve system. This is the first thing that exists that can do this. So I will recheck this now. It was 10 out of 10. Normally we wait 10 minutes, we hydrate the patients. I just want to show you how fast and effective this works. You can see her before, how she was crawling on the bench of pain. And that was not actually deep pressure pain that I did. I just touched the nerve and see how inflamed it was. Now I will increase the pressure about 200%. You ready for this?
Mm-hmm.
You sure? How is it now?
Better.
And this one?
Better.
Okay, now is the key. How much better is the arm when we remove this inflammation to this? So, as you saw before, the pressure was not so much here before. And now I will push a little. This is the pressure from before.
Mm.
And now I put 200%.
Yeah.
But you're still not crawling on the bench. You feel it's, I push harder.
Mm-hmm.
The same here.
Better.
It's weird, huh?
Yeah.
So you can see what is really important, what we teach here at the Academy, is to understand how things the body communicates. Because I want her, now I know, she feels a lot better. She already started planning to play tonight for sure. So I need to still remove this because all these tendon muscle here communicate with this here. And if one of them is over injured or inflamed, the other ones will compensate. And this is why it's so important to understand the human body 100%. I will remove this here also.
How much pain decrease?
Now? Oh, maybe 5?
50%?
Yeah.
That's what we're looking for. Minimum 50% reduction after 10 minutes. So I'm going to put one P200 here. I'm going to put another one here. At the same time, I'm actually covering the tendons that is overlapping each other and communicate with the biceps. I'm going to put a negative. We're going to take a hand like this. So I'm going to put a negative, like I create a triangle here. And I'm going to remove the free radicals in between here because I want this to heal up. And this works for 72 hours. And this your patient can go in shower, swimming, everything is normal. It's just important when the patient comes that the skin is as clean as possible. Because then they stick better. Because the glue that is used here, the tape on behind the device, is antibacterial and it sticks very, very hard. So clean the skin before. So we wait a little bit, just squeeze my hand. Now it's also different strength from before. Now I will be a little bit sadistic because now I will really try to give her a lot of pain. If this works as it should be doing, she will feel a little bit, but not as before that she was crawling on the bench.
Yeah, I feel pain, but less.
You can look at my thumb if you take the camera, and this is massive. Different, huh?
So different.
Squeeze. Now you see you have different strength, right?
Yeah.
If you do try to move the hand like this. Yeah, push it this way. Yeah. You feel anything in the elbow?
No.
Nothing?
No.
If you do like this, bend it up, push forward. No?
Nothing.
And try to move it like this. I will hold the elbow. Or you just wrist the wrist like you play with the racket.
This is my problem.
Yeah, you feel pain?
I move, no.
Okay.
Anything.
So this is how effective it is. This doesn't mean the injury is gone. The inflammation stops immediately, but of course the patient needs to follow methodology. The better she gets, she will get stronger and stronger devices. So we work all the way to the bottom of the skeletal cells. So she definitely doesn't get anything back. We have around 98% success with all our patients, no matter what they come with. And we have no relapses from the old injury if they follow through what we teach them to do.